So I have washed my hands and I am ready to introduce myself to the patient. My name is Kirsten. I'm going to be doing a neurological exam on you today. Can you please tell me your name and date of birth?
Jeremy, September 17th, 2000.
Perfect. All right. So first, I'm going to start by assessing your sense of smell. So I'm going to have you plug one of your nostrils, close your eyes, and tell me, take a deep breath, and tell me what you smell.
Mint.
Perfect. Okay. Now we're going to do the same thing, but on the other side. Deep breath.
Orange.
Okay. All right. So the patient has correctly identified both scents on each side. His sense of smell is intact and normal. Cranial nerve 1 is intact. All right. So now I'm going to assess your vision. I'm going to have you cover up one of your eyes and go ahead and look straight at my nose. Tell me how many fingers I'm holding up.
2, 3, 4, 1.
Perfect. Okay. Other side.
2, 1, 2, 4, 5.
Okay, good. All right, so patient correctly identified how many fingers I was holding up. Visual fields appear to be intact. Cranial nerve 3 is intact. Now I'm going to have you follow my pen with your eyes. Perfect. All right, go ahead, look straight ahead for me, and I'm going to shine this bright light in your eyes. All right. So pupils are equal in size, equal in consensual response to light and accommodation. Patient's 6 cardinal fields of vision appear to be intact. Cranial nerves 3, 4, and 6 are intact. Now I'm going to assess your sensation. So I'm going to have you close your eyes and I'm going to touch your face with an object. You're going to tell me if it feels sharp or dull. So this is sharp and this is dull. Okay, so go ahead, close your eyes. Tell me what you feel.
Dull. 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 Dull.
Okay. Patient's sensation is intact. He was able to correctly identify sharp and dull sensations symmetrically. Cranial nerve 5 is intact. Right, so now go ahead, clench your teeth for me. Good. Stick out your tongue. Squeeze your eyes shut. Squeeze them tight, tight, tight. All right, wrinkle your forehead for me. Okay. Puff out your cheeks. Okay, and give me a big smile. Perfect. All right, so no abnormal facial movements noted, no facial droop. Muscles appear symmetrical bilaterally. Facial muscles appear normal. Cranial nerves 5 and 7 appear to be intact. All right, so now we are going to assess your hearing. So I'm going to have you block one of your ears, and I'm going to come on the other side, and I'm going to whisper 3 numbers in your ear, and then I want you to tell me what I whispered, okay?
4, 6, 8.
Perfect. And we're going to do the same thing on the other side.
1, 7, 2.
All right. So the patient has correctly identified the numbers that I whispered in his ears. Hearing is intact bilaterally. Cranial nerve 8 is intact. All right. Now we are going to... Okay, now I'm going to assess your gag reflex. So I'm going to have you open your mouth and I'm going to stick in this tongue blade. Okay? Stick out your tongue. Okay. All right. So the gag reflex is intact, not hypersensitive, and the uvula is midline. Now I'm going to have you swallow some water. Okay, so I'm going to have you take a sip of that water. Right, so the patient's swallowing appears to be intact, swallows without difficulty, no coughing noted. So why don't you tell me about what you do for work? What do you do for your job?
Heavy stuff.
Where do you work?
Home Depot.
And what do you do at Home Depot?
Reset. Phase.
Okay. So the patient's speech is clear, slurring of speech not noted, no difficulty in pronouncing L, T, and N. Cranial nerves 9 and 10 are intact. All right, so now I'm going to have you shrug your shoulders for me. Shrug, good. And then now I'm going to push down, but still shrug your shoulders. Push against me. Good. All right, so patient is able to shrug shoulders symmetrical bilaterally, and the strength is 5 out of 5 bilaterally. So the last thing we're going to do is I'm going to examine your tongue movements. I'm going to have you stick your tongue out and back in. Okay, stick your tongue out again. We're going to go side to side. I'm going to have you curl it up towards your nose. Good. Now down to your chin. Very good. All right, so the patient is able to perform tongue movements without difficulty or any asymmetry. Tongue movements are normal. So that concludes our examination. Thank you for your participation today.
Thank you.